Hi everyone. Today we're going to talk about detoxification. Detoxification was a common topic that people had requested for us to discuss in our weekly chats. So let me first start out by saying that detoxification has really confused a lot of people in conventional healthcare and research circles, and people use the word detox. People feel like, well, that's unsubstantiated. It doesn't really mean anything. So the word detoxification is not really used in the scientific literature. They use the word hepatic biotransformation, and I think that's where the difference is. So you have like a lot of physicians like, oh, there's no such thing as it being toxic and detox and some of those things. And if you did a literature search on the National Library of Medicine for the detoxification, you're just going to find stuff related to people that have done drug abuse, but not necessarily chemical clearance. So in the actual scientific literature, it's called hepatic biotransformation. Just in case you were trying to find some studies and understand why there's some confusion. But at the end of the day, let's talk about what detoxification mechanisms are, and I'll try to talk to you about how they apply to health and clinical issues, and also then answer some questions. So just if you can give me a good 15 to 20 minutes, I can review the basic concepts for you. So the whole purpose of detoxification, it's just a physiological process where our body has to convert chemicals or fat soluble structures like hormones into a metabolite that we can eliminate from our bodies. So whenever we breathe air pollution, pollutants in the air, or we have things that go on our skin, just for example, holding on to receipts have BPA in them that gets through our skin. So whether we're breathing in chemicals, whether we're touching things that have chemicals on them, we put cosmetics on, there's lots of chemicals in them. Whether we're consuming foods that have toxic metabolites in there, whether we have things like formaldehyde being released from carpet and we walk into those vapors are getting into our system, we have some exposure to pollutants and chemicals that our body has to deal with. And the body will do a couple things with these pollutants and chemicals. One of the things that it will do is it will convert these chemicals into metabolites that our body can eliminate in urine, sweat, and feces, or the other option for it is to store it in tissue, and chemicals are stored in body fat. So adipocytes play a role in actually protecting our body from chemicals we can't clear, and there are many chemicals that are now called obesogens because the body has a hard time clearing them, so they're stored in body fat. And in research studies where they get individuals exposed, or animals I should say, exposed to obesogens, the most common one being, for example, BPA in plastics, that they can see that animals with the same caloric intake, but one group having higher amounts of BPA and obesogens gains more body fat. So the key thing with our body is the ability to clear these chemicals out. And if we can't clear these chemicals out, then they go into storage. Some chemicals are stored in body fat. There's also some chemicals that are stored in inside our bone marrow, in our bones. For example, lead. And also when people have, for example, osteoporosis, many times you see lead levels go really elevated because the chemical is stored in our skeletal structure. We can also see people that lose weight sometimes, have severe reactions, and part of that mechanism could be that chemicals being released from their body fat. So the way things work is we're constantly getting exposed to chemicals through the foods we eat, through things we breathe, through things we touch. Those chemicals then have to be eliminated. If they're not eliminated, they store in our skeletal tissue or they store in body fat. So then we got to discuss like what are the mechanisms that actually clear out chemicals and how do they work and what's the key thing with them. So basically all the different chemicals that we get exposed to eventually have to be metabolized again into compounds that we can eliminate through urine, sweat, or through our feces. So they got to be converted into what's called a water soluble state, and the liver has pathways that do that, and these pathways are called hepatic liver biotransformation pathways. So these biotransformation pathways really work to get rid of chemicals, and we have different biotransformation pathways. So these biotransformation pathways have different names. One's called glucuronidation, one's called sulfation, one's called acetylation, one's called methylation, one's called glutathione conjugation, and those names are in reference to what type of amino acid or chemical it binds to convert that toxic chemical into something that's water soluble so your body can eliminate it through urine, sweat, or feces. Now, when you look at the liver and you look at this biotransformation pathways, there are two phases to it. They call it phase 1 and phase 2. And in phase 1, all the different toxic pollutants and chemicals come in, and it's kind of like a big funnel. And this funnel has the initial job of what's called oxidation or reduction. And all that really means is that it's changing the structure of the chemical, because remember, the liver job is to take these chemicals, turn it into a water soluble state so it can become a metabolite that we can clear through urine, sweat, or feces. So in phase 1, when chemicals come in, there's this initial process called oxidation reduction or hydroxylation. All that really means is there's a transfer of an electron, or it's just some slight change to the structure of the chemical. And that is done to make it available to go into what's called phase 2. And phase 2 takes the change structure that's been so-called oxidized, reduced, or hydroxylated. So now something like an amino acid can bind to it, or another metabolite can bind to it. So for example, hormones or certain endocrine receptors like BPA, they come in, they go through phase 1 pathways, the structure changes, and then now that the structure has changed, can allow something like glutathione or something called glucuronic acid to bind to it. And once it binds to it, that compound becomes water soluble, and then we can eliminate it. So in order for us to get rid of chemicals, we have to have this healthy phase 1 pathway and healthy phase 2 pathway. Now, what the interesting thing is that when chemicals go through phase 1, they actually become much more reactive and much more inflammatory than before. This phase 1 process of oxidation reduction, which is necessary to change the structure so something in phase 2 can bind to it and make it water soluble, is a mechanism in which the molecule that goes through phase 1 actually becomes more of a free radical or oxidative response. So if someone has phase 2 impairments, for example, they don't have enough glutathione, then this phase 1 compound can get into circulation and cause lots of inflammation and oxidative stress. So it's really important for us to have healthy phase 2 pathways. Now, when we talk about phase 2 pathways, think of them as different coin sorters. Like you have a coin sorter for quarters, coin sorter for nickels, coin sorter for dimes, coin sorter for pennies, and different chemicals have to go through different pathways. So one pathway, for example, is called methylation. And a methylation means there's two carbons that are attached to the phase 1 metabolite. There's another one called acetylation. Acetyl group is one carbon, so one carbon is attached to that metabolite and becomes water soluble. Another one is, for example, glutathione conjugation. The tripeptide amino acid glutathione binds to that phase 1 end product and then becomes water soluble. Now, different chemicals go through these different phase 2 pathways. Some chemicals go through methylation, some chemicals go through glutathione conjugation, some chemicals go through glucuronidation, and we all have different degrees of efficiency in these biotransformation pathways. Okay, so that's the big picture, first of all, the first step of chemical detoxification. Hang in there with me, I'm going to take you through the steps, because detoxification isn't just like you take a botanical and everything's better. You really want to understand how this works and why there's so much diversity and why people respond differently to chemicals and why different people respond to some treatments and don't respond to other treatments. So the first key thing to understand is that we have these different phase 2 pathways, and these different phase 2 pathways clear out different chemicals. Now, what's very interesting, there is some genetics that impact how effective we are in clearing certain pathways. So some people have genetic uniquenesses where they're not efficient in one of these pathways. The most common one that we know about is the methyl-tetrahydrofolate reductase polymorphism, which is basically 20 to 25% of the U.S. population, for example, doesn't have efficient pathways for what's called methylation or the adding of a 2-carbon group, and they really need higher amounts of things like folate and B12 to make their system efficient compared to other people. So some people have genetic uniquenesses where they can't synthesize glutathione as much. Some people have genetic uniquenesses where they can't make enough glucuronic acid for these phase 2 pathways. So we all have different variations in our detox or liver biotransformation pathways. they call these pharmacogenetic pathways, and these pathways can change over time too. So, for example, if you had a genetic uniqueness where you didn't have ideal methylation just in your genes, and you also really became deficient in, let's say, nutrients that support this pathway, like B12 and folic acid, for whatever the reason may be, then you get exposed to a chemical that has to be metabolized by methylation, then you can have some serious problems. We know, for example, also that certain diseases have a hard time processing chemicals. Like patients that have Parkinson's disease have a very unique characteristic in them that they can't process and metabolize bisphenol A. We actually published a paper in the International Journal of Molecular Science where we showed patients that have Parkinson's disease, they can't clear out BPA, and then BPA becomes reactive and can create an immunoreactive response to something called alpha-synuclein. But the point is that certain chemicals are harder to metabolize by certain gene uniquenesses, and certain diseases have been associated with these gene uniquenesses, and this is where environment combined with your genes can make you at risk for certain exposures, and also certain vulnerabilities for mechanisms that may be compromised. I'll give you another example. Glucuronic acid is another phase 2 pathway where you detoxify chemicals. But in order to make glucuronic acid, you have to have glucose in the cells to be able to do that. So people that are chronically hypoglycemic, people that have uncontrolled blood sugar issues and diabetes, their glucuronic acid levels are not as efficient compared to healthy people. So since their blood sugar issue doesn't allow glucose to get in the cell, and glucose is a substrate to make glucuronic acid, and if you don't have enough glucuronic acid, you may not be able to metabolize chemicals as efficiency that depend on that phase 2 biotransformation pathway called glucuronidation. So that's the key thing. So you can have certain gene unique. So you have these chemicals that go to phase 1, they go to phase 2. You have different phase 2 pathways for different chemicals, and you have different genetic uniquenesses which make you more efficient or less efficient in processing these phase 2 pathways. And then your lifestyle and diet can play with your genes and then make you either more efficient or less efficient in metabolizing these chemicals. So you have this, you have this hepatic biotransformation pathway. And then this hepatic biotransformation pathway has to have this interplay between which chemicals your body gets exposed to and then how you clear these out. So that's the basic concept of what they call hepatic biotransformation. It's one of the mechanisms in proper detoxification. Now, typically, these phase 1 pathways and phase 2 pathways rely on some key nutrients to work. First of all, phase 1 pathways, this whole oxidation reduction, is highly dependent upon the body's antioxidant system to be able to quench some of those metabolites and also to play a role in some of these processes, especially glutathione. So you really need to have your antioxidant system fit for phase 1 pathways. Your phase 2 pathways really strongly dependent upon sulfur amino acids, glutathione conjugation sulfation, where they attach a sulfur amino acid from sulfur foods like garlic, onions, those types of things, are critical to provide the substrate to clear those out. Methylation, B12 folic acid, B vitamins. So typically when you look at what manufacturers produce for nutraceuticals to support liver clearance pathways, it's usually loaded with lots of things like sulfur amino acids like N-acetylcysteine, cysteine, glutathione, and different antioxidants and B vitamins, B12 folate, just basic Bs, because those are the cofactors that are supportive of phase 1, phase 2. Now, once these chemicals go through phase 1 and phase 2 and become a metabolite that's water soluble, the next step that has to happen is those compounds go through portal pathways and get combined with bile, and your gallbladder has to contract to release that those metabolites cleared by phase 1 and phase 2 into the GI tract, so it can combine with fecal material, so it can be eliminated when a person has a bowel movement. So once the liver does its job, then the gallbladder has to then those metabolites get synthesized and stored with bile, and then when bile is released to break down fats and also to part of normal digestion, those metabolites then become part of fecal material, so we can eliminate them. So gallbladder function is really, really critical. Even more interesting, they also found that these phase 1 and phase 2 pathways that take place in the liver also take place in the gut by bacteria, and they call this microbiome biotransformation, that bacterial species in the gut have enzymes, just like the liver does, to clear out pollutants and toxins and make them into a metabolite. The interesting thing about microbiome biotransformation is that different bacterial species have different enzymes that impact different chemicals. So one of the key things is that you really need to have healthy microbiome diversity to optimize the different types of bacteria, and different types of bacteria have different types of enzymes to metabolize different chemicals. So that's where hepatic biotransformation comes in. So those are essential. Now, having normal motility, having normal bowel movements, intestinal muscles contracting properly so you can move fecal material out of your system is important for the ability to eliminate these metabolites. The key thing is if you can't eliminate these toxic metabolites, then they recirculate into your system, and then you get this overload, which then increases oxidative stress and free radical responses. Now, if we go through the steps, so you have to have phase 1, which is highly dependent upon antioxidants. Phase 2, highly dependent upon sulfur, amino acids, B vitamins, and things like glutathione. And then once you go to phase 1, phase 2, it's really important to have healthy gallbladder function. Then the microbiome diversity is really critical to also metabolize phase 1, phase 2 pathways. And then you have to have regular bowel function to eliminate these compounds. Now, that's all related to fecal elimination, but then you also have pathways through your lymphatic system that are involved with sweating and urinating, and this involves the lymphatic system. So your lymphatic system is really involved with taking toxic metabolites, taking compounds to your liver so they can go through this whole process. And lymphatic function, your lymphatic system, if you think about how it works, is like if you look at the way your house is structured, and you look at your shower, the drains that get rid of all the water you use in your shower, that's part of the lymphatic system. So we have this lymphatic system. But a lymphatic system has to move compounds around as muscles contract. So as muscles contract, these lymph nodes are next to them, and they cause movement of these metabolites. So in order to have healthy lymphatic function to start metabolizing clearing chemicals, you have to actually have movement. So sedentary lifestyle is not really good for healthy lymphatic function. And then ultimately sweating, urinating, fecal output is all part of normal detoxification or biotransformation, getting rid of chemicals for our system. So when you're looking at this big picture, you have to kind of look at it and go, all right. And as a human being, we're all getting exposed to different chemicals. These different chemicals have to be eliminated. If they're not eliminated, then we have some problems. One of the problems is these chemicals store in tissue. If they store in body fat, they can promote increased body fat. This is the obesogen model of toxicology. It's not a theory. It's well published. It's a very established mechanism. We also know that toxic metabolites store in the skeletal muscle, especially things like lead. So if we can't metabolize the biotransform, they stay in our tissue. Now, the other thing that also happens is that if we can't get rid of these chemicals, they continue to cause inflammation and become free radicals in our system, which deplete our antioxidant systems, which then increase our risk for inflammation. And the other thing that we've found that these chemicals do is when chemicals don't get metabolized, they actually start to bind to proteins in our bodies. And the most common one is albumin. And they bind to a protein called albumin, which is usually there to control what's called our osmotic pressure, so our ability for our blood vessels to maintain a certain pressure so we don't have swelling. But when chemicals aren't metabolized through this detoxification pathways, they bind to proteins and they become what are called adjuvants or neoantigens, and they can trigger immune responses. And we've published several papers in the scientific literature regarding some of these interactions and reactions. But when chemicals bind to proteins, they change the structure. They become a new antigen, and the person makes antibodies against those. And those antibodies, we have found, are highly associated and increase risk for many different neurodegenerative diseases and different autoimmune diseases. So it's really important for us to be able to biotransform. So let's talk about, so what happens to a person that becomes chronically sick? How do chemicals play a role? How do these things really work? Well, if we go back, let's talk about what we really need to have healthy detoxification. Well, we need to have healthy phase 1, phase 2 pathways. We need to have all the different conjugation pathways as efficient as possible. We need to make sure our gallbladder works efficiently to contract. We need to make sure we have a very, very rich microbiome. We got to make sure we have high amounts of antioxidants, B vitamins, sulfur compounds. We need to make sure we have regular bowel movement. We need to make sure that our lymphatic system is engaged by us having movement and motion in our lives, and we have to have healthy amounts of sweating. Those are all part of normal function. So what happens to people? Well, some people go through life, they have a genetic uniqueness to one pathway, and they may take medication, they may get exposed to chemicals, and these pathways can get taxed. And this, and the combination of also research with different medications causing adverse effects, is a field of study called pharmacogenomics, where they study how different gene variations plus certain medications can lead to adverse effects because the body can't metabolize them. So our genes have some role, plus environment, plus these chemicals. And let's take a situation where a person, for example, goes on multiple medications or chemicals, their phase 1, phase 2 pathways get a little bit depleted. They stop eating really superfoods, healthy foods. They're eating the standard American diet, so they're not getting high amounts of flavonoids and antioxidants in their diet. Let's say they also smoke, that increases their free radical load. So now their phase 1 pathways are compromised. Let's say they don't eat any vegetables or very little vegetables, they don't have enough sulfur. Then their sulfation pathways get compromised. Let's say they get pre-diabetic, they can't get glucose in their cells. Now their glucuronidation pathways get a little metabolized, get a little imbalanced. Let's say they had a COMT gene polymorphism, which happens to 20-25% of the population. Now they can't methylate very well. Now they're going to respond to toxic chemicals much differently. Let's say even further, since their diet is so bad, they don't have microbiome diversity, so they can't biotransform chemicals through their gut pathways. And let's say they have a sedentary lifestyle. They don't move, so the lymphatic system is working. They don't exercise. They don't sweat well. So these things then increase, the so-called metabolite load, toxic load, and which causes inflammation, which causes free radicals. These chemicals then get stuck in the circulation. Adaptively, your body will store in body fat, so it increases weight gain, and gets stored in bone density, which can be a problem down the road when they start to have some normal bone loss as they age. And then some of these chemicals then bind to proteins in our blood, in our circulation, like albumin, and they create new antigens, and they cause this inflammatory response. So the combination of just unhealthy diet, sedentary lifestyle issues, toxic load really impact these systems. So that's the whole concept of detoxification. So those are the main things that I really wanted to cover with you. So I'm going to take some questions here in a sec. But one of the things that we also want to kind of go over is people who usually ask, well, what can I do? What kind of nutrients, what kind of things can I do to optimize my biotransformation pathways? So let's start with the liver first. When you look at the phase 1 pathways, with the phase 1 pathways, you have to have healthy amounts of antioxidants, like a diet really rich in what are called superfoods, blueberries, raspberries, foods with high amounts of antioxidants. Colorful food is really critical to provide those bioflavonoids that is so important for all of us. Even taking antioxidants, whether it's alpha-lipoic acid or vitamin E or glutathione are all really important. Also, sulfur. Things like N-acetylcysteine is really critical. We need to have sulfur to metabolize compounds. We need to have sulfur to make glutathione. For phase 1, phase 2. We need it for our gut, for biotransformation pathways too. So, in addition to taking antioxidants, you really want a diet really high in sulfur, or you at least may want to supplement with sulfur, especially if you're getting exposed to chemicals or multiple medications. You want to make sure your microbiome is very diverse. So you want to eat a diet very diverse in vegetables and fruits to impact fibers that then lead to different bacteria being formed in your gut. So the more diverse your fiber intake is, the greater potential you have to diversify your gut microbiome. And you want to have movement and exercise. Movement and exercise help your lymphatic system, and movement and exercise also help with sweating and getting your gastrointestinal motility to work. So those are all the main things that are involved with detox. All right, so let me try to take some questions here. And by the way, thank you for everyone that's joining us and from all over. It's always nice to some people let us know where they're coming in from. Okay. Let's see here. I've heard that we have to open up detox pathways before killing parasites, fungi, and viruses. Any truth to this? From Jonathan. Well, Jonathan, the key thing is there's all these theories in natural medicine. I don't know. And this is where it becomes philosophical. So, do you need to do that? I don't know. Some people say, oh, thank you. Got a chair.
It's cool.
My wonderful wife is here to help me with questions. I have to have a chair for her, but I forgot to bring it in. Anyways, so the thing with detoxification is you hear a lot of different theories, lots of different philosophies, and these are like what we call the philosophical field of nutrition. In the philosophical field of nutrition, you have everyone that has all types of theories of detoxification, everything from foot baths to energetic treatments to all types of stuff. What I just try to give you information with is the actual toxicology of biotransformation published in peer-reviewed literature and the actual physiology of those mechanisms and related to which actual cofactors and nutrients work for it. So, you're going to hear all different types of ways people talk about detoxification in alternative medicine. I think this is where there's a lot of hesitation with many conventional physicians to look at this because of some of these, theoretical things that are out there. Okay.
Okay.
Yes.
Hi. So, question. So, Therese, can detoxing cause gallbladder attacks? No gallstones on ultrasound.
Can detoxing cause gallbladder attacks? So again, I don't know what the word detoxing means.
Right.
That's a general term. Does that mean you're sweating more? Does that mean you're taking some supplements? Typically, you don't have to have gallstones on ultrasound. You can have what's called gallbladder sludge that may or may not show up on an ultrasound, but you may have some gallbladder bile thickness. And this is actually called gallbladder sludge. So if you have some gallbladder sludge that is not being picked up very well on ultrasound, which happens all the time, you can still have all the symptoms of gallbladder issues, but at the end of the day, you really want to do some interventions to prevent gallbladder, which would be making sure you don't eat any fats or fried food, even restricting oils for a period of time. And nutraceutically, people usually take things to thin bile. Dandelion root is a compound that's been shown to thin bile. Choline, betaine, trimethylglycine are all compounds that have been shown to support those bile thinning pathways. Coffee has been shown to help thin bile. People that are regular coffee drinkers tend to have some benefits of really having their bile released, and they actually show just having insulin and being overweight is going to promote sludge formation. So if you have a gallbladder issue and you're overweight, you may need to also look at your insulin levels and see if you can get that improved to get rid of that sludge. But if your gallbladder is not working, you're going to have inefficiency in your biotransformation or detoxification mechanisms.
Okay, Miriam's asking, why is it some people just can't break out in a sweat? What is the problem and how can you help fix it?
So if it's been your whole life, then that's just your autonomic nervous system. If it's new, one of the key things is like you may have to have greater metabolic demands as you get older to sweat. So you may have to work harder to get a good sweat. Yeah. The other key thing is you just might be dehydrated. There's a lot of people that are dehydrated. They don't even know it. They notice that they're not sweating because they just don't have enough hydration. So those are key things. Those would be the key areas. And, sometimes autonomics in the body changes. It is the way it is, but you got to do whatever you can to optimize these in any way you can. And exercise and sweating to whatever capacity you can do is still a factor.
Okay. Crystal, What can we use to support the liver before and after detoxifying? You might have answered that, but I was walking upstairs.
Yeah, I mean, the things we talk about for the liver are basically N-acetylcysteine, sulfur amino acids, glutathione support, milk thistle, dandelion root, ginger. Those are the most common things. Alpha-lipoic acid. Those are pretty common. In these days, when manufacturers make supplements to support detox or really it's hepatic biotransformation, they usually have all those things in products these days.
Okay, Marco, can toxicity cause mental health problems like chronic disabling depression and anxiety? If so, can detoxification be helpful for recovery?
Right. So, I mean, we know, like when you talk about depression and chronic major depressive disorder, one of the newer and exciting mechanisms getting a lot of attention in research circles is the inflammatory model of depression. They also call it the cytokine model of depression, where it's not really due to neurotransmitter imbalances, but it's really due to the brain being inflamed. So, there isn't direct links with biotransformation issues in depression. However, there is an intermediate step. If you're not biotransforming very well, it is possible you have greater susceptibility to an inflammatory load. So, ultimately, if someone is not healthy, not doing well, you may want to just optimize these biotransformation, detoxification pathways for the overall health. And I think we all hear that all the time. People that are really sick, they're really chronic, they go somewhere, they change their diet, they eat lots of vegetables and fruits and rich flavonoids, and they sweat, and they do all these things, and they finally start to heal and feel better. Those stories are all over. Everyone's medical histories throughout the country, all over the world, that happens. So we know that it's an important mechanism, but you don't know if it's a direct linear relationship unless you see some association. It's only an association. It's not a direct linear relationship. Let's put it that way.
Okay, Leah. Fantastic information and description. Given your knowledge of neuroinflammation, is taking the likes of coriander and other supplements to chelate likely to redistribute heavy metals to the brain, as some groups claim?
Okay. Well, let's talk about so another part of dealing with chemicals is what they call chelation. And chelation is basically taking a substance that then binds to the toxic compound so you can eliminate that. And not all toxins and pollutants can be cleared out of the body through our detoxification pathways or biotransformation through our liver, through our gut, and so forth. So things like mercury, things like arsenic, so heavy metals, for example, they are not metabolized through our liver and through our pathways. They just kind of just stuck in our tissue load, in our system. So people really refer to chelation for getting rid of those. And in a pharmaceutical model, there is different chelators. One's called DMSA, one's called DMPS, one's called EDTA, and they bind to the chemical, the heavy metal, for example, to clear that out of the body. And that's an independent pathway of liver biotransformation. In those studies, both with all three of those chelators, EDTA, DMPS, and DMSA, there has been shown some redistribution of those toxic chemicals into tissue, neurological tissue, more than any other. So there is some concern for that redistribution. However, if someone really has like very high, very toxic levels of lead or mercury that they can measure very clearly, for example, even in their blood, without even a challenge test, that might be the most appropriate thing. There are some natural chelators out there. Glutathione, for example, is a very natural chelator. Some people use different types of greens, Corellia and other compounds theoretically as a natural chelator. There isn't really there isn't much research on those compounds, but we know that glutathione has some good research on it, and it doesn't seem to redistribute. So that's a different approach. That's more of a binding or binding pathway than it is biotransformation pathway or chelation pathway. So it's independent of detoxification.
Okay, Sean, is there a way to test all of these detox pathways to help identify which are compromised?
There used to be a test that was done, and is still done in some research circles, where they measure someone's baseline urine test, and then they would give them chemicals like acetaminophen, caffeine, and even aspirin, and then they would look at the metabolites in their urine after, and they would see how much of the secondary compounds that are converted by these phase 1, phase 2 pathways showed up in the urine to get a clue from the load of caffeine and acetaminophen and aspirin they gave them to see how these pathways were doing. The problem with that test is there was some reliability, reproducibility issues in that test, probably because the biotransformation pathways are dynamic and changing all the time. So they're not really commercially available anymore. But that was the way that people have been testing these clinically in the past. And there's some publications where they look at a hepatic challenge test. And these hepatic challenge tests is they give them chemical and they measure the metabolite that the liver converts them into. So in research circles now it's available, but it's no longer available in commercial settings.
Okay, gentlemen, I have heard that we have to open up detox pathways first before killing parasites, fungus, viruses, etc. Is there any truth to that?
Yeah, this is one of the things that we talked a little bit earlier. This is where philosophical models of nutrition come in, and I really can't comment on that. That's the thing. There's going to be lots of different philosophies. Like you should open up this pathway first. You should do that first. You should do that first. I don't have any comment.
Okay, Sharon, can detoxification have effects on insulin resistance and blood sugar issues?
Can detoxification? Yes, it's possible that it can have that because there are certain chemicals that are actually called diobetogens, just like obesogen, diobetogens. So there are certain chemicals that completely disrupt insulin signaling pathways, and they're classified as these diobetogens. And theoretically, if you have increased load to them, and again, the most common diabetogen is actually, again, BPA, plastic products. It's an obesogen, it's a diabetogen. Pesticides are also on that list. But those chemicals do absolutely disrupt insulin signaling pathways within cells, and those chemicals can actually change the microbiome. So the microbiome loses the ability to release what are called incretin hormones. Incretin hormones are things like GIP, GLP-1 that are there to modulate insulin signaling pathways. So chemical loads with so-called diabetogens are absolutely a potential risk factor for impairing insulin signaling pathways and may be involved. So, and there's lots of research that are showing, epidemiological research showing clear overlapping curves between chemical load and things like glyphosates and the growth of diabetes, and that it can't be accounted for with just increased sugar consumption. So there's definitely a role of chemicals in diabetes and insulin resistance and obesity, and part of that may be involved with how efficient someone's biotransformation pathways are in combination with how much chemical load they're getting.
Okay. Sharon, if a person has problems with garlic, onions, and sulfur foods in general, would this indicate problems with phase 2?
Yes. If you're not getting enough sulfur, you don't have enough substrate, and some people can't handle sulfur. So, what can you really do? If you can't tolerate some of it, you want to ingest it. But if you can't tolerate, you may not have the substrate for sulfation, and you may have greater difficulty metabolizing things through sulfation. The good news is that chemicals and pollutants aren't completely metabolized just by one biotransformation pathway. There's multiple pathways involved. So even if your sulfation pathways are impaired, you may be able to metabolize a lot of chemicals and convert to a water-soluble state by your other phase 2 pathways. But yeah, there are just some people who cannot tolerate sulfur and can't process it very well, and they have to really count on these other biotransformation pathways in their phase 2 to work.
Okay, Owen, I have heard metabolites can flood the system during big detox processes. How can we best prevent these from reaching the brain, especially for those with leaky brain barriers?
Yeah, I mean, if you have a leaky blood-brain barrier, meaning you've done laboratory testing, confirm it with, let's say, S100B or blood-brain protein antibodies, like Cyrix-20 or A20, then you got to be very careful with biotransformation because you can actually promote neuroinflammation. And even, leaky gut, you may not want to go into a heavy chemical clearance if you have intestinal permeability. So whether you have intestinal permeability or blood-brain barrier permeability, you got to be careful. Sometimes you really may need to increase your antioxidant load for a period of time before you really start taking compounds to push phase 1, phase 2. But if you increase your antioxidant load, make your microbiome as diverse as possible with a high vegetable diet, sweat, move, do that for a period of time and see if those barriers heal, and then go into it. That might be theoretically a better option.
Okay. Can high stress shut down any of these pathways?
Can high stress shut down any of these pathways?
That's camera.
I mean, I don't. Stress will impact all the weak links in a person's health, because stress puts someone into what's called a catabolic state, and a catabolic state means you really can't recover very well. So stress responses in general put you in a catabolic state, so all the weaknesses come out. I don't know if stress directly impacting biotransformation pathways. You could be producing more cortisol, and there's greater demands for your body to clear out cortisol, for example, but it's not like the game changer. It's just something that adds to the total pool. Yeah.
Okay. Nora, is it true that curcumin blocks phase 2?
Is it true that curcumin blocks phase 2? These are over-exaggerated mechanisms. Your phase 2 pathway is not going to shut down because you take curcumin. So there's lots of different phase 2 enzymes, and certain flavonoids have some effects where they can turn one on, turn one down a little bit. Overall, you should not be concerned about curcumin impacting your phase 2 pathways.
Okay. Sharon, kind of off. What is the best test for intestinal permeability?
The best test for intestinal permeability, in my opinion, is Cyrex Laboratories, CYREX. They have a panel called Array Number 2, and it checks for occludin zonulin antibodies, actomycin antibodies, and lipopolysaccharides. And with those laboratory markers, we can tell if someone has different types of leaky gut and if they have something called endotoxemia. So when someone has leaky gut, sometimes the proteins that control the tight junctions break up. Sometimes the actual cell gets destroyed. We can tell that from the panel. Occludin zonulin means the tight junctions are broken down if they're elevated. Actomycin means the actual cells themselves have been destroyed all the way through, so meaning severe inflammatory reaction. And with LPS, we can determine if gram-negative bacteria and products that can cause inflammation throughout the body are actually getting absorbed. It's a blood test. So Cyrex Array 2 is the one to choose.
Okay. Sean, do you find organic acid testing useful in helping to determine where log jams exist in detox pathways? Organic acid.
Yeah, I mean, organic acid testing is a very general screen. I know it's really popular out there. You can look at some metabolites with organic acid testing. It'll give you some piece of information that can be somewhat useful, but it has limitations. You're only looking at a very small number of metabolites in a urine test, and so I guess I answered that. It's okay. It's okay.
Okay. Chrissy, what causes gallbladder sludge in someone without a gallbladder?
Well, when you get your gallbladder taken out, the cystic duct, which is where the gallbladder releases into common bile duct, actually pooches out and becomes a new gallbladder. So you can still have sludge. If you still haven't treated the underlying metabolic issues like insulin resistance, obesity, diet high in fats, lots of fried food, you're going to then have sludge all over your cystic duct and have all the same symptoms of a person who has a gallbladder issue.
Okay, Miriam, would dry brushing help open up the pores to help sweat?
Dry brushing, I'm not sure if it opens up the pores, but it definitely gets rid of dead skin and makes your skin feel great. I don't know.
Okay.
I like to do it.
Okay. That's good to know.
Makes you look a lot nicer. Your skin feels soft.
Okay. Can I take Paula, can I take liposomal glutathione at night?
Yes, you can take liposomal glutathione night, morning, afternoon, whenever you want. And liposomal in a liquid form means you don't have to take it with food. So whatever works for you. And everyone's going to be unique and different in their own way.
Right.
But majority of people have no problem taking liposomal glutathione at any time.
Okay, Kay is asking, what are your thoughts on fermented foods?
Fantastic. Fermented foods, one of the best ways you can change your microbiome and make your microbiome more diverse. So fermented foods are going to have a very powerful impact on providing short-chain fatty acids, which diversify gut bacteria. They turn on regulatory T cells that block intestinal inflammation. They impact signaling pathways called G-coupled proteins to improve your insulin modulation and regulation. They're like one of the, if you look at superfoods and fermented foods, you're looking at the best things you can eat to really support detoxification and improve your oral health. So you definitely want to increase your fermented food intake.
Okay. Correct. Deirdre, what's the best way to bring down a high beta glucuronidase level?
Best way to bring down high beta glucuronidase level?
Yeah.
Eat superfoods and fermented foods.
There you go. Okay.
By the way, beta glucuronidase is an enzyme in the gut bacteria, and it basically, when your liver metabolizes chemicals or even hormones to glucuronide metabolite, there's an enzyme in the gut called beta glucuronidase, which can take off that conjugated compound the liver has worked so hard to put on to make it water soluble, and then that compound can't be eliminated anymore. And this happens with dysbiosis. So when people get dysbiosis, sometimes these unhealthy bacteria have these enzymes that really sabotages all the hard work the liver has done through phase 2. So part of healthy detoxification is making sure your microbiome is healthy and diversified and doesn't have dysbiosis, meaning overgrowth of unhealthy bacteria to good bacteria. So the best way to change your dysbiosis that can raise beta-glucuronidase activity is lots of healthy fermented foods, lots of vegetables, lots of superfoods, antioxidants. Those would be the best strategies.
Okay. This is just relevant. Debbie's asking, anything new for type 1 diabetes cure?
Anything new? I think our contribution is something I could talk about. We did publish a paper in the Journal of Diabetes Research on foods that cross-react with type 1 diabetes target proteins. Maybe Susan can post it. Journal of Diabetes Research. And we found that certain foods have molecular mimicry with these target proteins. So we checked what's called islet cell antigens, ZN28 antigens, GAT65 antigens, and we found if a person has antibodies to these foods, those antibodies may cross-react and promote an autoimmune response in those target proteins. So I definitely check out that literature.
Okay. Does from Debbie, does the lack of intrinsic factor impact detox?
Does lack of intrinsic factor impact detox? Well, maybe. Intrinsic factor is critical to carry and absorb B12. So if you don't have the ability to absorb B12, you can become B12 deficient, and that's one of the key things with pernicious anemia. Pernicious anemia, they get antibodies to intrinsic factor, but some people just don't have much intrinsic factor genetically. So their ability to actually absorb B12 becomes inefficient, so they need much, much higher amounts of B12 to function properly, and if it's pretty severe, they may need B12 shots. But B12 is critical for a pathway in the liver called methylation. The ability to transfer carbon groups is called methylation. It's totally dependent upon B12 and folate. So if someone has intrinsic factor deficiencies, they can have potentially impaired methylation, and impaired methylation can raise what's called homocysteine on a blood test. And if you have impaired methylation because of that, and you get exposed to chemicals or medication that go through methylation, you can have some adverse effects with that.
Okay, Tamra, do coffee enemas really work?
Do coffee enemas really work? They have published some studies on causing gallbladder contraction. So coffee, whether it's taken orally or even a coffee enema, does cause some gallbladder contraction. And for some people who can't get rid of waste material, they just constipated for whatever the reason may be, a coffee enema may offer some benefits. And the way it works is that caffeine binds to what are called acetylcholine receptors, and these acetylcholine receptors are involved with activating smooth muscles in the gut to contract so you can have bowel movements, and also causes the gallbladder to contract. So for people that really do have significant constipation for whatever the reasons may be, and for people that really need to get more gallbladder contraction, coffee enemas can activate that acetylcholine receptor with the caffeine exposure and can cause motility and contraction of the gallbladder, and that might be useful for some people.
Okay. Jonathan, what's the role of prebiotics in detoxing?
So prebiotics have a really important role. Prebiotics are used by your gut microbiome to populate their the healthy bacteria in your gut, and prebiotics also can help diversify your gut. And the more healthy bacteria and diversity you have in your gut, the more efficient your gastrointestinal biotransformation is for the ability to clear out chemicals through your microbiome. So that's where prebiotics really shine. Things like fiber can also bind to chemicals and help bulking and eliminate pollutants and toxic compounds your body's dealing with as well. So most prebiotics are fiber sources.
Okay. Does the B12 we take have to be methylated in order to help with methylation?
Does the B12 we take have to be methylated? I mean, like methylcobalamin? No, methyl is just a converter. B12 isn't methylated. B12 helps with the methylation process. Methylation is the transfer of one carbon groups, like homocysteine to cysteine, cysteine to cystine. That's a methylation pathway. B12 helps as a cofactor, but B12 doesn't need to be methylated. There are different types of B12, like cyanocobalamin or methylcobalamin. It makes sense if you're trying to improve your methylation to take a methyl B12, methylcobalamin, because not only do you get the B12 that's important for that one transfer carbon group called methylation, but you also have some methyl group there to help as well.
Okay, Noah, have you done a chelation talk, or can you do a chelation talk?
Yes, we can do a chelation talk. We'll put on the list. Thank you for your suggestions.
Yeah.
We really appreciate people joining us, and if you do have topics like this topic, I would never have thought to do, but people requested it, so we will put that on the list. Thank you.
Okay, perfect. Do toxins play a role in fibromyalgia?
Yes.
Okay.
So listen, toxins and pollutants and chemicals play a role in all chronic diseases to some degree, because they all have the potential to increase inflammation and increase oxidative stress. But you have to consider why there's a hard time in acceptance of that with the literature, is because there's a lot of variability and uniqueness between different human beings. Some human beings get exposed to chemicals and not have any issues, and other people don't. Some people smoke cigars every day and they're 100 years old and it's still taken away. They're really efficient in getting rid of benzene and benzene rings, and it has no effect on them. Whereas someone else gets into a smoky room, gets exposed to some smoke and gets sick for a day or two because they have an autoimmune disease and can't handle benzene clearance. So in theory, any toxic load, chronic inflammation promotes all chronic disease mechanisms, whether it's fibromyalgia or a neurodegenerative disease or anything. The difficulty is that there's so much variability from one person to the next, it becomes hard to get enough people in a study sample to find anything statistically significant because of the high degree of variability, and this is why there's some hesitation with it in research circles.
Okay, Veronica's saying, can you please do a talk on infertility?
Infertility, I could do one on that.
Well, you're doing
We'll add that on the list, yeah.
Right, but for healthcare practitioners, if they want to know.
Yeah, we'll do one. We do have a seminar coming up at the Kharrazian Institute on infertility. It's really for healthcare professionals, but it's launched in November. And if you want more information on that, please go to Kharrazian Institute, Kharrazian Institute.com. My last name, it's long. Sometimes I forget how to spell it properly too.
Spell it again.
I spell it Kharrazian Institute. And also, if you haven't already joined our newsletter, please go to Dr. K News, DRKNEWS. We have articles and online programs if you're interested in that.
Okay, Michael's asking, do you find activated charcoal, bentonite clay, I'm sorry.
Active charcoal, bentonite clay,
zeolite are all excellent in binding.
Yes.
Or any other great ones worth noting. Sorry, it goes fast.
So zeolite, bentonite clay, charcoal, they are active binders. If you feel like you get exposed to some toxic chemicals, compounds, you can use them as a binder. And they bind to it, and then you can make sure you're having plenty of fiber and you're hydrated when you're using those, so you can eliminate them. But you also got to be careful consuming those on a regular basis, because they also bind to your micronutrients. So if you're taking activated charcoal every day, you're decreasing your micronutrient levels too, because they bind as equally to them as they do to other compounds as well. So they shouldn't be used on a regular basis. They should only be used if you really have some exposure, and be careful about that.
Another topic is the HPA axis.
Okay, we do one on the HPA axis here.
Yeah. Okay. Elaine is asking, ideas on clearing toxic compounds from the hazardous smoke levels many of us have been living through in the West with all the fires.
Well, the number one thing is with toxic, the air from burning and chemicals is really all the biotransformation pathways are involved, but especially you need to increase your antioxidant load. Things like alpha lipoic acid could be very beneficial to you, and then things like my favorites are always resveratrol, and curcumin, turmeric, especially in liposomal form, and glutathione, trisomal glutathione. Those seem to hit a lot of the antioxidant pathways very aggressively, and they're very, very effective.
Okay. Any specific time to take the binders?
Technically you want to take binders in between meals so you get the least amount of micronutrient binding with them. Mm-hmm. So typically done in between meals.
Okay. Oh, it was the role of probiotics in detoxification. I just put
the role of probiotics?
Probiotics.
Probiotics. So here's the thing. There's an intimate relationship between the liver and the gut. The liver metabolizes compounds, goes to the gut. The gut can sabotage that through different enzymes like beta-glucuronidase, or it cannot, or it can help with that biotransformation pathways. Probiotics have benefits to some degree in some people. I think you would get much more out of prebiotics for biotransformation than a probiotic, because probiotics vary on what the host's bacteria microbiome is. Some people that have healthy amounts of good bacteria or have this, they not respond to certain strains that you take, so it's strain dependent, and different people respond to different strains of probiotics, but prebiotics will definitely be the way to go. So any kind of fiber source, fermented foods like someone mentioned, just taking pectin, guar gum, psyllium husk, those all are prebiotics that are very effective.
Okay, Leah, would you suggest coffee enemas with autoimmunity? I'm thinking about molecular mimicry problems.
There was some initial research that shows coffees can cross-react with gluten. Some people were worried about that, and then later investigation found that it wasn't the actual flavonoids in coffee that were cross-reacting, but the coffee beans were contaminated, and many suppliers of coffee use transport pathways and bins and trucks that also contain gluten compounds. So there was some cross-contamination with coffee beans. I know in the Dr. Bijdani's lab, he actually investigated this, didn't publish it, but he found Starbucks didn't have any cross-contamination.
Yay!
And probably the reason is because all they do is distribute and transport coffee in their chains of manufacturing and producing and getting beans from all over here. So if you're worried about cross-contamination, use Starbucks beans. It could change. I mean, this was done a few years ago. Maybe the lines can contaminate, but most coffee beans are cross-contaminated with gluten, and for autoimmune it could be an issue if you're gluten sensitive.
Okay, Alessia, I think. Do normal homocysteine levels confirm that methylation is normal, and we don't need help with methylation and vitamin B supplementation? So if you have normal,
well, if you have homocysteine levels is a marker that you measure in the blood, and homocysteine gets converted to something called cysteine through this pathway called methylation, which is also what your liver uses. Theoretically, if your homocysteine levels are normal, then you don't have a significant methylation defect, but it doesn't mean having more methyl substrates doesn't optimize your biotransformation. So it's really more of a marker to tell you you're in trouble. It doesn't mean that you don't need to support your methylation pathways if you're exposed to chemicals that really require methylation. A very interesting thing also is when you look at drug inserts where they look at adverse effects, those drug inserts will actually list which liver pathways or the medication is metabolized through. So if you have, for example, a drug that says it's metabolized through methylation and your homocysteine's high, then you may have some concerns with being a little bit increased risk for an adverse effect from it. Or may need less of it, but these are all the variations that are out there.
Okay. Sorry. Is sauerkraut a good prebiotic?
Sauerkraut's a great prebiotic. Kimchi is fantastic.
Mm-hmm.
Pickled vegetables. Yeah. They're all great.
It's making my mouth water. Jennifer, would hydrocolonic therapy help detox efforts?
Not really. I mean, maybe it's not supporting phase one, phase two. It's not supporting gallbladder contraction. It's not changing microbiome diversity. It's not causing more lymphatic drainage. It's just kind of getting rid of debris and junk that may be stuck from motility issues, but it's not the most impactful way. The most impactful way is to optimize phase one, phase two pathways, make sure your gallbladder is working, make sure your microbiome is very diverse, have regular movement, exercise, sweat. Those are the main things.
Okay, here's a kind of two-parter. For men, detoxing and mild traumatic brain injury with ongoing issues, anything specific to be aware of? If you're detoxing and you have mild traumatic brain injuries, and there's ongoing issues still with the brain injury, is there anything you want to be aware of there?
So lots of publications show that traumatic brain injuries immediately break down the blood barrier. So when there's an injury to the brain, neurons are sheared and they're broken. The actual astroglial cells open up the blood-brain barrier to allow T cells and immune cells in to get rid of the debris from the injury. So the blood-brain barrier normally opens up after traumatic brain injury to help get rid of the debris by getting immune cells that come in. That also creates the possibility for environmental compounds to get into the brain as well. So you got to be careful, especially in the acute phases of traumatic brain injury, really going into really supporting detoxification theoretically, or definitely getting exposed to chemicals and increasing your toxic load, because those compounds can then perpetuate the neuroinflammatory response if they can cross the barrier system. So I would really focus, if it was in my practice working with someone with traumatic brain injury, I would really focus on raising their glutathione levels. Mm-hmm. And the reason I say that is because glutathione has been shown to shift what are called microglial cells that cause brain inflammation from an M1 inflammatory state to an M2 anti-inflammatory state. They also have been shown to heal the blood-brain barrier. They're a natural chelator, and it supports phase one and phase two. So I think the best clinical strategy after traumatic brain injury to help the brain, help the blood-brain barrier, also help phase one and phase two detox would be glutathione, liposomal glutathione, IV glutathione, things like N-acetylcysteine to raise glutathione. Those would be the best strategies. Okay, one last question.
No, two more questions.
Two more, okay.
Lane, can fermented vegetables be harmful for people with IBS and SIBO?
Well, for sure, if you have small intestinal bacterial overgrowth, you may not be able to handle foods that you can't have on a FODMAP diet, including many of the fermented vegetables. But for IBS, this is the other question?
IBS?
Yeah, for IBS. For IBS and irritable bowel syndrome, irritable bowel syndrome is a general term. We just know the GI is not efficient, is inflamed, it's not working well. So we got to figure out what the mechanism of IBS is. But for most people, fermented foods tend to have a beneficial effect on their gut. But there are some uniquenesses, and for sure with SIBO people, they have to be worried about the fiber.
Okay, and then from Susan, can you please mention that all of the resources will be posted on the link sites, and that also people are asking about your other courses and other things you do?
Yes.
Oral tolerance, that kind of stuff. You can just mention them slowly, so she can post them, please.
Yes.
Thank you.
So Susan, okay, thank you, Susan. So we have an online program at Dr. K News called 3D Immune Tolerance, where we talk about how to improve your immune tolerance, which is your body's ability to react or not react to food proteins and chemical triggers and so forth. We kind of go over the science and clinical application of that into a preventive lifestyle medicine model. And then we have a course called the Save Your Brain program, which is an online program in 6 sections where we teach you how to implement strategies to improve your brain function, slow down mechanisms of neurodegeneration or inflammation through diet, nutrition, lifestyle. And we have our books. Why Isn't My Brain Working? Is a book you can find on Amazon. Why Do I Still Have Thyroid Symptoms is another book you can also find on Amazon that I've written. And then our postgraduate information is at the Kharrazian Institute. The next course is on infertility. We've had courses on neuroinflammation, diabetes, autoimmunity, Hashimoto's that are available on demand. And we have a newsletter you can sign up for at Dr. K News, DRK News. And if you're wanting to not miss any of these lectures, make sure you follow us on Facebook, so you can always see what the next topics are and be reminded of it.
I have one thing to clarify. I'm really sorry. Someone's. All right. Okay. I didn't say it, you did. Dr. Ortiz meant, I think Dr. Ortiz meant if a drug needs to be cleared through methyl pathways and you have low homocysteine, you should be concerned. I think he said high homocysteine.
No, it's high homocysteine. High homocysteine means you cannot methylate. You need methylation to clear homocysteine into cysteine. So it's high homocysteine. Okay. All right. Thank you, everyone, for joining us. And next week, we'll do a new topic. Bye.